hop in, but we'll just kick things off here on our side. And thank you everyone for joining us for an event around postpartum anxiety. I know I have watched so many of my friends struggle with postpartum depression and anxiety. And, I think while it's definitely become destigmatized over the last couple of years, and thanks to the work of, people like our two panelists today, I think that often like women just don't feel equipped to have the right toolkit or to understand what's going on with them. And, postpartum is such a crazy time of hormone changes and just like structural changes. That's often kind of hard to know what to look for and what's happening kind of in your mind and body and how those all can interact. So excited to share a bit about what to look for, what the various kinds of symptoms are, and sort of there's lots of different flavors of postpartum mental health. And so hopefully it can be a resource for you, whether you're pregnant or recently postpartum. And yeah, excited to talk through it. So a quick reminder, we are recording this session. So we'll share it with everyone who registered after. So if you have to hop off or something comes up, don't worry, you'll get all the content. And just as a little reminder, we're not providing medical advice. So if you have any questions afterwards or that we can't answer during the Q&A, just make sure you reach out to your provider or, someone who is equipped to handle those questions. So with that, I will kick us off. So I'm Allison Grant. I lead the marketing team here at Origin. We're a company focused on pelvic floor physical therapy, and really believe this type of care should be accessible to everyone. So we are a network, and we'll talk a little bit about this in the event today, but there's a huge kind of connection between the mind and body during pregnancy and postpartum. And there's some data to show that physical therapy postpartum can also really do wonders for your mental health. So excited to share that with you. And then I will introduce our two speakers for today. So first we have Jen Schwartz, who's the founder of Motherhood Understood. This is an incredible resource. I just found out about Jen kind of in the last year, and it's really the leading support community and story sharing hub for women impacted by pregnancy and postpartum mental health issues. Jen herself, I'm sure she'll share a little bit about this during the event, but survived postpartum depression and basically created a ton of incredible resources for this broader community. And then we have Dr. Sarah Oreck, who is a psychiatrist focused on women's health. So she also is like really unique in her training specifically around reproductive psychiatry, and has her own private practice that does talk therapy, meditation, and whole body kind of approach, very aligned with what we do at Origin and thinking about a whole body approach to treating patients. So excited to kick things off. So I think there's a lot to talk about. Like I said, we're going to cover broad postpartum mental health. Like I know I, for one, until going through this, didn't totally understand the difference between postpartum depression and anxiety. So we'll touch on that. We'll touch on just sort of what it feels like and what to look for. I think that's often the most visceral, is like when you hear someone else talking about it, and I'm sure Jen can share a little bit, but that's where it can really resonate. We'll talk about the mind-body connection, like I said, as we think about physical therapy and just how that can support you in your mental health, and then how to seek help. And then I know we got a lot of questions in advance as well. So we'll try to kind of pepper those into the discussion, but also we'll leave time for Q&A at the end. So with that, I think we can talk about, it's like, you just had a baby. Okay, like what's going on in your mind? There's a ton happening from a hormonal perspective. Like I said, lots of disruptions. But I think this is like a really staggering fact for me, which is that 1 in 5 women will experience maternal mental health. I don't know, Sarah, like as you think about your patients, is this like, is this surprising, or are you just like, yeah, it's not, I think we see this everywhere.
Yeah, I see it so much. And sometimes I think it's actually, we're underestimating it, because often we're just starting to talk about it. And people like Jen are real trailblazers, but, 20 years ago, we weren't talking about this at all, right? I'm sort of a generation that still remembers Brooke Shield admitting that she had postpartum depression and sort of like what happened after that. And that seemed to be one of the first times, at least in the United States, where we started sort of the conversation a bit more. But I really do think this underestimates it often, because we have things like postpartum anxiety, postpartum OCD, postpartum birth, PTSD from birth trauma. And I don't think that is isn't as recognized yet, or sort of in this this research is quite limited. My field is probably like 30 years old. It's pretty new.
Yeah.
And so I do think even within the psychiatric academic world and psychology world, this is also relatively new in how much we're researching and sort of understanding about it.
Yeah, definitely. And I think the stats I found were just like really, this is like to your point about discounting or like undercounting. It's 80% of women like experience baby blues, and like, who knows what in that is, really just like temporary kind of hormonal changes. But I guess as you sort of think about the broader population, what, like, are you seeing this during pregnancy, postpartum? And I know, Jen, you think about this too a little bit.
Yeah, so I actually see that most of the mood issues start during pregnancy, and actually pregnancy related either depression, anxiety is a real risk factor for postpartum depression and anxiety. And that's something that's so important to think about. And actually, we think 50% of cases start during pregnancy, but often we have, I think, this idealized version of how beautiful pregnancy is, and it's sort of rainbows and sunshine and nothing could be wrong. You're about to have this baby. But truly, I do think, especially in pregnancy, it's undercounted, and maybe we're starting to count more what happens in the postpartum. But I think it's important to normalize the huge fluctuation of hormones that occurs right at birth. And this is why we see those baby blues for about the 1 to 2 weeks postpartum. But quickly that changes. And in the 3rd to 4th week, we really start to see the differentiation between depression and baby blues. And we'll talk more about that. But I'd love to hear Jen's perspective as well on this.
Sure. I think one of the issues, and I also think we're underestimating the amount of women that are affected by pregnancy and postpartum mental health illnesses. I think I want to say that we give more attention to postpartum mental health illnesses than during pregnancy postpartum mental health illnesses still. I also think if you think about the numbers and the stats, these are numbers and stats from women who are reporting that they are experiencing these things or they've gotten help. So we're not necessarily including the ones that stay quiet and suffer in silence. And I also think what is confusing is that this is not your typical mental health illness, and it's not your typical depression or anxiety. And what makes it really difficult is that it's not one size fits all. So I think every single mother, her experience is different. So, for example, my experience was I was hit like a Mack truck with postpartum depression the day after I got home from the hospital. And that falls into that 1 to 2 week category of baby blues. And what's interesting is I was not prepared. Nobody talked to me about mental health during pregnancy. I didn't know what was happening to me, except feeling like something, was wrong with me personally. And I was the only woman on the planet suffering because I thought, other women
totally. It's very visceral. Yeah.
Loved having babies and being mothers. And, that's what you're born for. And I went to my OB the next day or 2 days later. So I probably was at maybe like 7 or 8 days postpartum. And she wouldn't diagnose me with anything because it fell within the 1 to 2 week baby blue category. And she sent me on my way with an anti-anxiety medication. And the thing is that my symptoms and what I was experiencing were so intense that there's no way that it was just the baby blues. I think maybe to an eye of a trained psychiatrist or therapist like Dr. Oreck, who is in the field and specializes, I don't blame my OB. I don't think that they're necessarily trained as well as they should be in this. But again, I fell within that 1 to 2 weeks, and I clearly had a postpartum mood and anxiety disorder, right? And because of that, it was my, search to find what was going on in treatment and all that was prolonged. When really, if, again, it's hard because again, it's not a one size fits all. It really is a case by case basis. And in my case, that question, which I, tell I'm sure we'll talk more about this, but, every mom needs to ask themselves, or, who their partner needs to ask them is, what is the extent that my feelings are impacting my just everyday functioning, and the impact they were having on my everyday functioning was not going to resolve itself without intervention. And you could see that way before the 2-week postpartum mark.
That is so important to discuss, because I do think that there's this sort of box that you put in, well, 1-2 weeks, you can feel whatever it is, but actually baby blues can be differentiated from postpartum depression pretty early, because in postpartum depression, you have a sense of hopelessness. Some of the safety risks come up, sort of thoughts of maybe not wanting to be alive or not wanting to take care of this baby, sort of things and functional impairment that's way beyond what baby blues is. Baby blues is, we typically think, a time where there's some mood fluctuations, maybe a little bit more irritability, some crying that comes out of nowhere, but there isn't the hopelessness. There's the sort of like, I'll get through this and sort of move on. But I do think sometimes there is not enough training in the OB world. I actually try to do some of that with some of the local hospitals here. So OBs can kind of have more of an eye out. And that came actually after California mandated that there had to be some assessment of anxiety and depression and mental health issues during pregnancy. It had never been done.
Yeah. My sister-in-law's an OB, and I often like ask her about this. I'm like, is this something that you're thinking about? And she's like, I have 15 minutes for this like 6-week checkup, and it's like I'm only getting to it if they are like really raising the like, red flag. And I guess my other question is like, how long would you, I know they say like your baby's first years, but I guess like how long is the window sort of postpartum depression or any of these postpartum mental health concerns as you think about it? I mean, we always joke like postpartum is forever. So
right. It's a year. It's a year.
Right. They say it's
baby
a year
for life.
Right. Like I'm putting it in quotes that like technically it's up to a year, but it's a little bit of bullshit in a way, because I know women who are into 2 years and 3 years, and sometimes it comes later, right? And so I think the other thing to note too, and again, I think why the numbers don't necessarily tell the full story, I think there's another two reasons, right? One, a lot of women are getting these illnesses 6 to 9 months in, sometimes 12 months, they're happening later. Or if they're going undiagnosed and untreated in that first year, and they don't either know what's going on, or they don't realize that they're suffering, they just, feel like they're failing, or this is normal, new motherhood, that's going to spill into year 2 and year 3. So it's hard to know. And I also, and I'm glad that we're, focusing on postpartum anxiety, because I think the other confusing thing is that we say depression so much, but so much of this, and again, another reason why you kind of know whether it's the baby blues or not, is the anxiety piece, is that persistent crippling anxiety that's part of this. Even part of a lot of times postpartum depression manifests as anxiety more than, curling up in a fetal position crying. Right. I think that, again, these are reasons why it's so hard to go by statistics or put that time limit on when these illnesses can present themselves.
Yeah. I mean, I think that's a good like transition to, just sort of like, what are the varying kind of things that you think about seeing or treating, Sarah, is like, some of the more common, varietals, as it were. And I think it's like, we think of like one size fits all. I feel like people talk a lot about PPD, but there are so many different,
many different things. And I think what's difficult about this, might be a little bit more academic, but it sort of shows you where even general psychiatrists are kind of out of their depth sometimes. We don't have what we call DSM-5, which is our diagnostic statistical manual, which is where we sort of categorize every single mental illness. We don't have separate categories for these. These are subsections. And like Jen mentioned, but these are actually acutely very different from what people experience. Often people who experience these have never had any other kind of mental health issue. Obviously, having a mental health issue in the past can be a risk factor for perinatal or postpartum symptoms. But I think it's unique in that there isn't an ICD code specifically for most of these, which is really troubling. And I know there's people in the field trying to sort of change this, but I think that also makes it difficult to diagnose, especially for people who aren't really tapped into this world or have had a lot of experience with it.
Yeah.
Right. What I learned when I got better and I started kind of creating resources and looking into why I wasn't prepared, for what I went through. And I had also learned this from the postpartum therapist I saw, is that, right, forever we called everything postpartum depression. We labeled everything postpartum depression, like as if that was an umbrella. And the thing is that, like Dr. Oreck said, these illnesses are all different. And you might have postpartum anxiety or OCD, PTSD or psychosis, but because we labeled everything postpartum depression, those symptoms don't apply to you. And you kind of feel like, oh, well, then what now? What's wrong with me? Or I guess this is normal. Or, and I know, we've tried to make the switch to perinatal mood and anxiety disorders, PMADs, right, instead of postpartum depression. But and again, for me, when I was 8 months pregnant, and I don't think that I was in that 50% of women who are depressed during pregnancy and then it, carries over. I had a pretty easy pregnancy. I was pretty happy. I had more of the fairy tale vision of what motherhood was going to be like versus the pregnancy stuff. But a friend actually who had a baby 6 months before me asked me in my 8th month if I was worried about any postpartum depression stuff. Those were her words. And I flat out responded without even thinking, of course not, that would never happen to me. I'm excited to be a mom. I wanted this, right? And, I have a supportive family and I have all this help lined up and all these things. But in my head, I didn't even know what postpartum depression was. In my head, that was when you harmed yourself or harmed your baby, right? Which can happen usually in postpartum psychosis, which is something completely different. It's the least common form of the PMADs, but it's also what we see on the news and what we see
everywhere,
right, in pop culture and in the media. So we don't know. And that happened to me. And so I think even when I started to experience postpartum depression, I didn't realize that was what was happening because I didn't have any of those feelings. And I didn't even know postpartum psychosis was a thing. Right? Even with Brooke Shields had postpartum OCD. She didn't have postpartum depression, right? But we know that
it's like lumped together. Yeah.
Right. We're very well versed in this world, but somebody else might not right. And so there's a lot of nuances, and it's tough. It's tough from a clinical, standpoint. And I think it's tough from the, the motherhood postpartum standpoint too.
And what's hard is, like, I think a lot of people end up in a position where Jen is, where she ends up having to be, and I know this was sort of after, but like an advocate for yourself, or like convincing a physician, no, this is what I have from what I've done research on, which is just sort of an experience, unfortunately, a lot of my patients have had. And that feels like a disservice. This is not something that we should be sort of having to advocate or convince a physician to sort of help us with, or a therapist to help us with.
Yeah, absolutely. Well, I think like I said, I learned a lot about sort of the differences and nuances here. So I think, especially like we said, sort of postpartum anxiety is often conflated or can be confused with postpartum depression. So I'd love like a little primer from you, Dr. Oreck, and sort of how you see like the overlap and like where the differences are. Just I think there is a lot of nuance potentially, and so
there's
clarity, but that'll be helpful.
Of course. And actually, like, stepping backward, I think it's important, stepping back a little bit, it's important to also think about worry as being, there is something normal, right, about some level of worry and some anxiety. We use anxiety a lot, but I think it's more worry around becoming a new parent. These are infants that cannot care for themselves. They are, right, quite fragile, quite vulnerable. And so there is something biological. Our amygdalas actually change in pregnancy. The primary parent usually has an enlarged amygdala, is very sort of hypervigilant to baby's cries, to baby's needs. And those kinds of worries are within the normal range. When it starts to sort of cross over into postpartum anxiety, are sort of issues of, I like to think of it as sort of the volume gets dialed up on that to the point that becomes like sort of difficult to function and to do things. A great example is like difficult bathing the baby, right? We all have worries. Oh, this baby could slip, or this baby, whatever could happen to it. And then sort of feeling so frozen by that of not even doing it. And I think there is quite a bit of overlap. You're seeing all the overlapping symptoms. Each postpartum depression and anxiety can both have sleep disturbances. They often are a little bit different, but irritability can often be right either from anxiety or depression. And so this is where I think there gets to the muddling, and often, we're trying to separate these, but as Jen said, they often come together.
Yeah.
Anxiety and depression are sort of those a dynamic duo that doesn't usually come separate. Sometimes it does, but often what I see is pretty significant anxiety symptoms that are so functionally impairing that it ends up cascading into a depression, or similarly feeling so depressed that sort of anxieties come up or intrusive thoughts start coming in, which are again more of OCD, but that's sort of a subsection of anxiety. And the main differences really are postpartum anxiety often has a great deal of physical symptoms, and people often think that there's something going on physically, or that they're having, either like a heart issue is what I present with, or that I'm having trouble breathing. And that sometimes, especially for people who have a difficulty sort of with registering what emotions they're feeling, often the physical symptoms can be the first tip off. But physical symptoms are also quite pronounced in another subset of postpartum anxiety, which is postpartum panic attacks. So again, it becomes pretty difficult to sort of sort these out. I think it's important to just understand the nuances. I don't think each individual needs to be burdened with sort of self-diagnosing or label. Right, exactly. Just that these can come in sort of a variety of different ways, and that they're not always the same. And I think that's what Jen is really trying, like, I think in her experience and what I've seen of her stuff, it's like there is this range, which is important to keep in mind. So then you're not left with like, well, gee, I don't have a desire to, like an infanticide ish. Like, I don't think I'm at risk for infanticide. I must not have any of this.
Right.
Which again is more of the postpartum psychosis, which is so different. It's a medical emergency. It looks quite different from all of these things. There's actually a pretty significant component of like, it almost looks like delirium. This is like patients who are in and out of consciousness. There's a lot of actually vital sign fluctuations. It looks very different from this. And I think people often get worried that that's what they might have. But often it's more in line with intrusive thoughts, which we will talk about in a moment. And when we know that depression is there, is that there's a real marked sadness, low mood, hopelessness, the suicidal thoughts, or even thoughts more passively about not wanting to be alive, or sort of thinking you might not be the right mom for this baby, those kinds of thoughts. But Jen, I'd love to hear your thoughts on all of this.
It's interesting because even though I mainly say that I had postpartum depression, I do think I had both, because I couldn't get out of, I had the sadness and the tears, and I couldn't get out of bed. I didn't really want to leave my bed ever, but the worst symptom I had of everything was the anxiety. The anxiety was crippling. I would have done anything to make it stop. That was the most debilitating part of all of it. So I do think that there is an overlap, and, it's not maybe so much as important as, oh, you have PPA or you have PPD, is, oh, we're going to get you the help you need for what you're feeling. Right. And also when I was building our video hub on YouTube, the Maternal Mental Health in Minutes, one of the things I learned was that I want to say the therapist who I worked with, she had given me the statistic, and I'm not, again, a clinician, but that about 8 out of 10 moms that are seen present with anxiety as their leading symptom. Oh. So the anxiety is really something that, that is happening across the board, whether it's postpartum depression. And again, postpartum OCD is almost like just an off, right? Like a spinoff of, postpartum anxiety. And Dr. Oreck brought up intrusive thoughts. I think the intrusive thought piece is definitely probably a little bit of a differentiator between the depression and the anxiety, because these intrusive thoughts are coming from a place of anxiety. When you have these kind of intrusive thoughts where you kind of visualize or see something bad happening to your baby, or you see yourself doing something bad to the baby. I know a mom who took all the knives out of the kitchen, that because of intrusive thoughts. I know another mom who would stay downstairs all day with the baby because she would have visions of the baby falling down the stairs or her throwing the baby down the stairs. And the thing is that, and I think, and again, I'm not a therapist, so Dr. Oreck, I'd love for you to weigh in, but what I have learned though, is that, right, the thing about intrusive thoughts is that's exactly what they are. You know, you're not going to act on them, but you still have them and they're really scary. You know, they can be helped with medication, just like a average postpartum depression or anxiety diagnosis. But I do think that component kind of leans more towards the anxiety side.
Absolutely. And I see this so much. I actually rarely see someone who has postpartum anxiety and then we sort of co-diagnose it with OCD not have intrusive thoughts. They are so common.
It's 90% or something.
Yeah, I loved what Jen's explanation of it. And it's exactly that. It's ego dystonic. It's not something that you would want to do, which is actually the different presentation from postpartum psychosis.
Right.
There's a psychosis around what the infant represents, where these people don't feel like it's ego dystonic, and that's pretty scary. But I think with intrusive thoughts, there's still so much shame around it. I still see so many patients who have no idea what's happening and are afraid to talk about it. But going back to sort of the sort of underlying worries that are part of normal parenthood, I do think that there is sort of a biological underpinning to this, where you're actually seeing everything in the environment in sort of hypervigilantly that could cause harm to this infant. And instead of sort of it feeling like, okay, I'm making sure the knives are here, right? The stairs are here, being careful, right? The intrusive thoughts sometimes come in such difficult images, but I think it's important to sort of think about them as they're actually protective, right? They're figuring out how we can protect this infant. And yet with the anxiety, it sort of becomes a cycle of sort of shame and concern about not being a good enough mother and what this means about my mothering and whether I even want this child. And so I think that we still have to do so much education around normalizing intrusive thoughts, but also cluing in, there might be something more going on, especially if they stop me from doing things, or I'm no longer cooking because I'm afraid that I'm going to sort of do something to harm my baby. But I see it so commonly in postpartum anxiety. I don't think I've seen a case in the recent couple of years that did not include intrusive thoughts.
And the thing is that no woman is going to her OB appointments when she's pregnant and being told that intrusive thoughts are a thing. Right?
No, and if they do, yeah,
right.
If they do, yeah, I did my residency at Columbia, which is a fantastic program, one of the best programs in general psychiatry. And I had a patient who was seen by one of my colleagues in the ER, and she expressed intrusive thoughts, and they were interpreted as wanting to harm the baby.
Right, and that's the other thing. So when you have 90% of new moms experience some form of intrusive thought, yet we're not educating them about them in pregnancy. We're not telling moms, hey, this might happen to you. It might not, but so you're aware, you might have these things called intrusive thoughts. There's nothing to be ashamed of. It doesn't mean that you're going to harm your baby. Please speak up, because nobody's going to take your baby when you tell them, right?
Right. So, but also important to educate clinicians. And that's something I'm passionate about, because if this patient didn't have the luck of me coming into my shift and I was like, no, we can't hold this woman. Like, this is not a reason to psychiatrically hospitalize her and separate her from her baby. I do think that there's still more education that's required sort of globally around this, and sort of reassuring parents that we're not going to, call child protective services over an intrusive thought that was never, materialized into anything.
Yeah, absolutely. I know we had a couple of, someone asked in advance, sort of why does it seem, and maybe it's just that from a reporting perspective, but that postpartum depression and anxiety are much more common in the US? Or are there a bunch of other conflating factors, or do you have any thoughts on that, Sarah?
I mean, one of the things that comes up for me immediately, I do think we have, some reporting and some European countries are also pretty advanced in their reproductive psychiatry sort of knowledge bases. But apart from maybe we're looking at it more, I do think that there's an issue here of lack of support and really families not being so together, right? Kids maybe go to bigger cities, there's fragmentation in families. And I do think the loss of that multi-generational raising of children and supporting moms is lost. And I do think some other cultures do a much better job of like the 40 days of mothering the mother. Right. Like I just think of the hospital here where now that there's no nurseries, you're just like, hey, you just had a C-section or you had a 3-day delivery, like labor. Oh, here's your baby. Take care of it for the next 3 days. Good luck. We'll be in if you need us. But there isn't the support of like, how are we taking care of mothers? That seems to be lacking. And I do think that sometimes that lack of support does really set people up for some of these PMADs.
Yeah. I think it's 100. I think that's 100% right. I think our country is one of the most backwards when it comes to caring for the mother.
Too, any support,
right? Caring for the mother, especially postpartum. You know, she's cared for when she has the baby in her belly, but once the baby comes out, she is very much forgotten. And I think about, right, those other cultures where, you know, that mom is pretty much resting for 40 days and she basically, her job is to rest, heal, and feed her baby. But remember, she has all this family around, right? There's aunts and older women and grandmas, you know, who, like, again, it's cliche, but the village, the village is kind of dead in that sense. And we move away from our, you know, our parents. I also think too, that we're not training, right? We're not educating providers. You know, I mean, the fact that OBs, you know, are not trained in this specifically for a long period of time in med school, right? We're not educating providers enough, the providers who see the women up close, OBs, pediatricians, right? Even general doctors in a sense, because sometimes that's all a mom can get into at the time, right? And we're not educating women in their current, right? We're not educating the parents to be.
Yeah. And we talk about it a lot at Origin too, where you see, you know, you get like, you have a million appointments like leading up to the delivery, and then you have one to kind of check in with.
Right.
They send you, in the American healthcare system, we send you home with like an ice pack and you have like
Princess
one
the Pauper.
appointment.
I mean, actually the hospital, you know, the hospital course to me is like, is there any other sort of huge experience or surgery or major life event where you just sort of throw a patient to care for someone else?
Right.
It just feels like, what is going on here?
Right. I mean, look, they might, right, and they leave and they show you a video about the car, you know, putting the car seat in the car. Maybe at least show a video about postpartum depression. You know, I mean, we're just not, the education before pregnancy for both parents and providers is just, it's still sorely lacking. It really is.
I also think the expectations, right? There's some expectations here of breastfeeding for a year without sort of talking about what the implications of that are, including sleep deprivation, and sort of coming down on women for making choices that are other than that, right? To preserve their mental health. So I think that definitely also contributes to some of this.
Yeah, I think, I know in my experience, the hospital I gave birth at, when I gave birth, which was almost 9 years ago, there was a nursery. I sent my baby to the nursery. I had always planned to breastfeed and supplement because I wanted some protected sleep. So in that, when my baby would go to the nursery, I would let them feed him formula and I would nap, and then they'd bring the baby back and I would let them take the baby overnight. That hospital now is what's called baby friendly, and there are no nurseries. Your baby is in the room with you the entire time.
Wow.
They promote exclusive breastfeeding, and whatever you decide, you know, however you decide to feed your baby, fine, but there is a lot of guilt and shame that goes with that kind of mentality. I mean, even the name alone, so I don't want to breastfeed my kid, or I want to send my kid to the nursery.
You're baby unfriendly.
Baby friendly. I think a long time ago, I'd written a Huffington Post article interviewing several moms who gave birth at baby friendly hospitals just because of their experiences. I mean, you know, so I think there are also, right, we're setting them up for failure before they go home, which is not helping.
Yeah, definitely. Yeah. And these, I mean, I'm sure some of these resonate probably with both of you and what you hear from patients, but these are things that our PTs said, you know, like when they are thinking about like referring patients, just some of the most common things that they're hearing. And this is, you know, this is some women who wouldn't acknowledge that they have mental health, like challenges or concerns, but I think, sort of the what it feels like is very potent, I feel. So I know we've touched on this a little bit, but, any other like sort of symptoms that you would flag, like to just sort of be wary of, or, you know, this is more than the baby blues, or I know it's sort of like if it's going on, but just like common things that you all either felt yourself or see frequently?
I was just going to say, I do think that, and probably more along the lines of the anxiety piece, but if, like Dr. Oreck said, some worry is normal, right? I mean, you just are given a tiny human to go, you know, take care of, and they're depending on you for everything and to keep them alive. But I think, and this goes in pregnancy too, if you're doing things kind of obsessively, like you find yourself constantly checking on the baby at night to make sure he or she's breathing, you know, and you're not sleeping, or you're obsessively writing down every ounce of formula or breast milk, or you know, you're pregnant and you buy that heart rate monitor and you're constantly listening to the baby. These kinds of anxious actions, I think those go beyond the scope, right? The normal scope of just normal new parent worry. So I think it's important to be, you know, to look out for that. I also think that anger and the irritability piece is huge too. I think I repost this all the time. I don't think that most people know that postpartum depression and anxiety can manifest as anger and irritability and even rage. And so I think a lot of times it's confusing that a mom is like, why do I hate my partner? Or like, why am I so angry at everything? Or like, why don't I want to do any of these things? And so I do think that the anger irritability piece is definitely something to just keep on top of. And then for me, the biggest thing is the joy and the socialization piece. You know, if you're not finding joy in the things you used to find joy in, if you really are becoming a hermit and you don't want to see anyone or talk to anyone or leave your house or drive your car, or, you know, just those big changes in behavior, I think are red flags.
Yeah,
I totally agree with those. I think one that I really liked that Jen's bringing up is sort of that hypervigilance around vital signs and checking breathing that often goes hand in hand with feeling like other people around you who are plenty trustworthy can't take care of your baby, and not wanting to sort of share that, and then being overburdened, burnt out, overtired. I also think, you know, these have become exceedingly popular. But I think there's some collusion with like the baby outlet or things that monitor
I know.
at home
My friends are like, I can't get those because it's too it's like a gateway to it.
Yeah, I never recommend those. I know they feel like they're technologically like really cool and advanced, but you know, they're not hospital grade. It doesn't really make sense for you to be tracking a lot of those things, right? I don't think people should have those heart monitors in pregnancy. I sometimes don't even think kick counts are that helpful, even though they are used by a variety of different OBs. I love that you mentioned rage, because I think generally rage and anger is just something that we don't allow for as much in women, especially in our culture. So we often think, oh, well, when men are depressed, they often express anger, irritability before sadness or low mood. But in fact, women can also have those symptoms. And I think it's really important to highlight that actually might fall into one of these and not a separate issue. But again, I think you're right on, Jen, with like the functional impairment and how important it is to sort of think about those things. And if things have radically changed in terms of your interests or socialization.
Awesome. Well, and I would touch a little bit on the mind-body connection piece. Let me just add a question. Let's see if it's, it was a question around, if it's not treated, how long can PPMD stick around?
So I guess that's PMAD. So any sort of postpartum mood or anxiety, you know, this depends. The natural history can really range. But truly what ends up sort of suffering is your attachment to the baby, which in those first few months and years is so integral. And so even though, yes, some of these might self-resolve, and I don't think we have much data on exactly what the natural course is, we ultimately feel like it makes more sense to treat. And so you're able to sort of get those moments and not have a loss of those. Also, during pregnancy, we have a lot of studies to demonstrate that untreated illness is actually a risk factor in and of itself. And so we're seeing the outcomes in children, including higher risk of mental health issues outside of the genetic issues, sort of what you would bring to the table or your partner would bring to the table. We also see preterm labor, small for gestational size. Like, there are risks to untreated mental health issues. And even if you're not carrying the baby any longer, I think there are risks to you, to sort of your family unit, to missing out on these times because of your suffering. And of course, there's a great deal of stigma around getting treatment. But I really think it's worthwhile sort of overcoming that. And treatment doesn't always have to look the same. You know, I do want to be clear that treatment for mild to moderate cases of anxiety and depression starts with really good quality therapy. I think it's challenging because when you see a PCP or OB, they sort of reflexively give you an SSRI without a bigger discussion. But it's important to note that that's not generally sort of the first step. It is when there's a severe depression with hopelessness, you know, any suicidal thoughts, any sort of real functional impairment, I would often start with a medication there.
Yeah.
Well, I was sorry.
Yeah,
I was just going to add to that too. I think that the other thing is that you have at least a 50% chance of having a PMAD with your subsequent with your subsequent babies if you had it already. So let's say you had it and it went untreated, and maybe you did feel better. Maybe in some ways it resolved on its own. It really could come back, you know, even worse in your next pregnancy. I know so many women. I have so many friends who have told me that they definitely had something in their first pregnancy, and they really didn't even realize until their second pregnancy, because they let it go untreated and it was worse in their second pregnancy. So I do think that there are longer ramifications, even if you feel like it ends up going away on its own.
Yeah. And I have seen that so much, and really see second and third pregnancies that are really corrective experiences because of enjoying or being more present in the pregnancy and the postpartum.
Yeah, that makes sense. And I know, Sarah, you were just talking about sort of like how and you were both kind of talking about the rage element. I think this quote really, embodies for me sort of how women are kind of taught to act or behave, and why I think so often probably the amount of women who are experiencing postpartum mental health issues is undercounted, is because we're sort of taught, you know, not that like we're being difficult, or that this is unreasonable, or that these emotions, you know, like we just need to control.
We're hysterical, don't you know?
Yeah. Oh yeah, exactly. Yeah. I mean, the root of hysteria, is kills me. And so I just think it's like really important, and we think about this a lot, to like really just listen to your body. And I think physical therapy, is and just like the general movement. I think there's a lot of things that we'll talk about to help with your mental health and kind of that postpartum period. But there's some research that suggests that PT can reduce your risk of postpartum depression by up to 50%. I think, like all things in women's health, we need like more data and studies around this. But I think it's sort of that act of self-care, that act of seeking support, of seeking other outlets. You know, it reduces kind of like that isolation that you might be feeling, like kind of feeling like your body is not your own. And potentially like any birth trauma that could have, you know, led to some pelvic floor issues. But I think, you know, RPTC, like there's so much kind of hormonal change that happens in those first couple of weeks and months that can impact how like your body actually feels. And I think that often having sort of that clinical perspective to just talk about like, yeah, this is normal for you to experience this kind of pain, or this is not, and like, how can we help you is really, you know, really helpful, especially as we think about one of the most common things that we see postpartum that also impacts mental health is pain with sex. And I think a lot of women sort of suffer in silence. You know, you're told at like 6 weeks, oh, you're good to go. Like you can exercise again, you can have sex again, you can do like back to business. And I think So often that's like really should be, it's a one size fits all that's applied.
Yes, that is so individualized.
Yeah. And there's a lot of fear associated with that. And especially if you aren't enjoying it, like pressure and that I think, can lead to that increase in depression. I think where pelvic floor PT can really kind of step in there a little bit.
I mean, I think this actually connects to maybe the question before, and I haven't looked at the rates in France, but I know that's a country that offers, I think, to everyone, pelvic floor PT after birth. And I sort of think about that level of support, and then to have these countries that actually provide childcare and paid time and paid leave, and how different that feels when in fact, it feels like you're being supported and encouraged to make this decision, which is so different from our experience. But I am such a proponent of pelvic PT and really have seen such a difference in some of my patients who are also experiencing PMADs.
Yeah. And then I think the most kind of important piece of this equation is really like, how do you seek help for this? Like, what do you go to? So I know Jen, like you obviously, sought support and like have an incredible community. So I'd love your take on this just to start.
So I personally think the first person you go to is a specialist, is a therapist and or psychiatrist who specializes in maternal mental health and reproductive health. A lot of women don't know this, right? I didn't know it at the time because we're not educated. But seeing somebody who specializes in these illnesses makes all the difference because, again, they're not one size fits all. They're completely different than your just run-of-the-mill mental illnesses. And so therapy, I think, is huge. I'm a huge supporter of medication. I took medication when I was suffering. It was the very first time I'd ever taken an antidepressant. When I say that I'm a huge supporter of medication, I'm a huge supporter of medication coupled with therapy. I think that in my experience, I went on medication very quickly. I saw the therapist first because that was who I happened to find. And I should say that I did see a therapist initially who did not specialize. I just, found a family therapist in my area. And when I sat down on that couch, she wanted to talk about ways I could be a good mother. And I didn't even want to be a mother. It was really horrible. I left feeling even worse than before. I still had no idea what was wrong with me. And when I got home, I Googled postpartum depression therapist, Charlotte, North Carolina. And one woman her name came up. I called her immediately. It was a Sunday. I left a voicemail. She called me back the next day. She fit me in that Tuesday. And what happened in that first appointment, and this is why I say the specialist is so important, is that three things happened. When I was sitting in the lobby, she gave me a sheet to fill out, and it was a sheet of risk factors to check off. And I had a lot of these risk factors that I had no idea were even things, right? So the first thing that happened was I checked off all of these risk factors and
you're like, is there one box that just like applies to all?
But they were even things like you moved fairly close to having a baby. You had lots of family around. And well, I actually went into labor at my at the Seder table in front of 30 of my closest Jewish family members, like something out of a movie. And they were all here like through the bris, and so,
oh God.
Right. But what happened was when I checked those boxes, it took the blame off of me. So that was the first thing that happened, right? The therapist who knows what she's doing and knows and is well-versed in these illnesses, it took the blame off of me. This wasn't my fault. There were other factors at play that led me to this point. When I started talking to her, she told me that I had postpartum depression, right? So she gave me she gave a name to the thing I was going through. And she explained to me that she had treated thousands of women before me, all who went on to get better. Because when you're in it, when you're in the thick of it at the beginning, you don't care about any of that. You want to be told that if you do X, Y, and Z, you will get better by this date. And that is physically impossible for anyone to tell you. But she told me that I wasn't alone, right? Because she told me that she had treated thousands of women just like me. And all of this was news to me, And even though I didn't believe her that I was going to get better, and I started going to her twice a week, it was like a little bit of light, at least, because I had some type of answers, right? And someone in my corner who knew what was going on. So the specialization of the therapist is huge. her and my regular doctor got me into a psychiatrist pretty fast, and he did not specialize. We don't have an amazing psychiatry department in Charlotte, North Carolina. And I know your profession, like reproductive psychiatrists, are few and far between, right? There are not enough.
Yeah,
There's like 11 training programs,
Right.
and most of those are very new. Yeah.
Right. And what I will say about the medication, and which is why I speak so freely about it, is what the medication did was it got me back to this sort of baseline of myself. So I was able to fight the illness. So I was able to get in the car and drive to the therapy appointment and sit on my therapist's couch and talk about what needed to be talked about, and until I started to just start to have better days and feel good. So the medication, it's right, it's a band-aid in the right in the sense.
It's like a
right?
and it's like a small part. I think people sometimes overestimate.
Or they underestimate, right? Like, it's going to change my personality. I'm going to be on it forever. I still take my antidepressant, but you don't have to, right? Like you might not be on it forever. And if it changes your personality, it's not the right one for you. And I think that can be frustrating, but the combo of the therapy and the medication for me was key. I think support groups can be helpful. I think I remember, it's funny, I remember my therapist not recommending the support group initially at first.
Yeah.
Because she felt like it was going to be too much to be around that many moms. Or if a mom was worse, maybe you thought you were going to get worse, but I think if you can't go to therapy, or you can't find a therapist, or, it's cost prohibitive, support groups are great. And a lot of times you make friends that way. I know when my sister had her baby and she struggled with postpartum anxiety, she was going to the new mom school in at Hoag Hospital, and she made all these wonderful friends, and they were all in the same place, right? With babies the same age.
That's pretty incredible.
Right.
Yeah,
so I think the support groups can actually be really helpful.
Yeah.
And then I added sleep to this, because I think that one of the things that we don't talk about is protected sleep for the mom. And it's hard, especially if you're breastfeeding or pumping, because you are on that kind of set 3-hour schedule, that even if someone else is feeding the baby, you still have to pump, right? Or it's painful. For me, I ended up giving up breastfeeding after 5 days because it was taking a toll on its mental health. It also allowed me to sleep at night because somebody else could feed the baby. And I really think if I had not gotten that protected sleep, it would have been way worse.
And I think that that's something, right, that we need to start, like, this pendulum swing to being baby friendly or unfriendly with breast, like, needs to change, because everyone's needs are different. And some people are like, without sleep can sort of do really well, but when you have risk factors for PMADs, it really is a setup for, and I agree that sleep is one of these huge pieces of the pie. Like, on a prescription, this would be the first prescription I would write over any medication, is just get some sleep. But we're sort of attached. There's so much pressure around, breastfeeding being a way to be a good mother, that I think it becomes really problematic for a lot of people. But I love sort of Jen's sentiments about specialization. I also think it's important, but I often think it's not accessible to many people.
Right.
And that becomes the tricky piece. So I love the idea of sort of a support group. And I do think that with a good therapist, if there's an established relationship, or there's an opportunity to teach a little bit as a patient and experience. But I think it becomes hard, especially with general psychiatrists who often aren't up to date on the literature and are not doing sort of right by the patients. I see so many people in the community where a general psychiatrist who maybe has no training in perinatal psychiatry says, "Oh, you're pregnant, let's take you off of all of your meds," with like a past history of anxiety or depression, and then it's sort of a disaster. So I do think specialized care, if you can, is really great. And PSI is a wonderful organization where they've trained a lot of providers, where a lot of people, I think, are starting to get some of this training.
And PSI is usually the first place because I will get a lot of messages on Instagram, or just from, people I know. Hey, I have a friend, I'm struggling. I have a friend who's struggling. Do you know any specialists? in this area. And sometimes I can say, oh, hey, I know this woman, or let me ask, my network of people. But if I can't, Postpartum Support International has a helpline that anyone can call, right? Any mom can call. And what's so great about it is that they call you or, back right away, and they tell you where the support groups and the specialists are in your area, which is super helpful.
Oh, yeah.
Right.
And
the
have
other
virtual support groups, I think.
Right.
So,
exactly.
yeah.
And that was the other thing I was going to say. Since COVID, right, and when COVID happened and everybody closed their offices, everybody pivoted in the sense that so much of this went online. So I do think the access to specialists and support groups, even if they're virtual, right, even right now, has increased so much. And I think a lot of places that have even gone back to in person have kept their virtual support. And I know in New York City, the Motherhood Center, they literally they put everything online when COVID caused all the shutdowns. My therapist, who I saw postpartum, and I see every now and then too, just like, just as a check-in, because I like, it's great.
It's like a good, like you go to your PCP. Yeah.
She's a therapist for an organization called Doctors on Demand, and it allows her to see patients in lots of different cities. And I want to say that, cost-wise, they work with you, right? So there are a lot of these virtual options to try out, even if it's just a support group to start.
Yeah. Well, I know we just have a minute or two left, so I wanted to, if there's any questions, feel free to drop them into the chat, but I wanted to make sure we answer some of the ones that we got in advance too, which was one that we saw was sort of what are the best tools for processing through a traumatic childbirth? Like if that's the root of some of your postpartum mental health, like how do you typically, and obviously it's unique and I'm sure custom, but how do you think about that, Sarah? Or is that something you see frequently?
Oh, absolutely. And I think there's a variety of different methods. I think, a lot of narrative work around the trauma can be helpful, but again, this should be done, I think, with a professional, especially if you're having significant symptoms as a result of the trauma. I think piecing it together with your partner, debriefing with your OB can be helpful, even though often that does not happen. They're sort of like, isn't discussed this crazy birth that just happened. And so I think a little bit of that can be helpful. I also like a strategy called EMDR, which is sort of for another time, but it's a rapid eye movement therapy, which sounds really crazy, but it works.
It's amazing.
It's absolutely incredible. It's actually something I offer, but when I was doing the training and I was doing it on myself, I was like, I'm a little skeptical. This feels like, but I actually like a lot of like hypnosis and meditation. So it's sort of in that same realm. And I think it's absolutely incredible and gets to things so much faster than sometimes a traditional psychotherapy, sort of talk therapy can, even though I think talk therapy can also help through trauma.
Great. And then I think one last question and then we'll call it a night, but do you find mothers with a colicky baby have a higher risk for postpartum depression or anxiety, or is there any correlation there?
Yeah, a colicky baby or any, a baby with any type of difficulty like that is absolutely a risk factor for a postpartum mental health illness, because it's extremely stressful. It's unknown and it's putting stress on you. It is definitely going to affect your sleep and your relationship with your partner. It's absolutely a risk factor.
Oh, I completely agree. And I think here is where there might be another issue with breastfeeding, that often colic, and again, we don't understand what it is. It's just sort of a crying baby for unexplained reasons. But
I remember when I learned that colic just mean like you have a difficult baby.
Yeah, exactly. But I do think sometimes there are allergies, there are sensitivities to milk, and then you have people kind of trying to change their whole diets and eliminate things and change things, when sometimes a little formula might be